He calls what's happening in China a horrible déjà vu. Schools are being closed, cities going into lockdown again, more than 2 years after the pandemic began. Are we headed for the same fate here with another wave? And of course, all this as the Quebec government is getting ready to lift the state of emergency, and for the last couple of weeks, restrictions have been lifted. Is this the right way to go? Let's find out what Aaron DERFEL has to say about it, health reporter at the Montreal Gazette. Thanks for your time again today, Aaron.
Good afternoon, Natasha.
That kind of haunted me when I saw this thread the other night. The déjà vu thing. I think that we're all in a constant state of bracing ourselves for that. So tell us what's going on in China, and I guess should we really be bracing ourselves?
Okay, a pleasure to do so, Natasha. In China right now, some of the evidence is that their vaccines might not be as effective, and not all of the elderly have been vaccinated. And at the same time, you have the BA2 subvariant that's circulating. So China is really taking no chances and has closed entire cities down, locked them down, as well as schools. So that's what I mean by the déjà vu. And since I wrote that thread, others have come forward from China to say, yes, this is happening. There are reports that they're even building one of these hospitals quickly to deal with a possible wave of hospitalizations and deaths. Why are they doing that? Perhaps because the vaccination rate among the elderly is lower, and their vaccine might not be as effective. They've also indicated that this virus has the term that they're using is like a degree of concealment. We know that earlier the BA2 variant has been described as a stealth subvariant, that it was harder to pick up. So maybe there's a little bit of that. So this is what's happening in China, similar to what's happening in Hong Kong, where Hong Kong had the zero COVID approach, but the elderly weren't vaccinated. So right now, Hong Kong is reporting a death rate that's off the charts, again, among the elderly. And so the concern here is when you look at Europe, they're also reporting a resurgence in cases. And it's been driven by BA2, which is much more contagious than Omicron variant, which itself was super contagious. And at the same time, there's waning immunity in vaccination. So, for example, in Quebec today or yesterday, Quebec reported 79 new hospitalizations, and of that number, 42. or a little over half were among those who had gotten 3 doses. So what happens is over time, the vaccines, the immunity given by these vaccines wanes. At the same time as you have, this more contagious strain emerging. And in Quebec and many other jurisdictions in North America, we're easing the public health measures. So is this a recipe for a sixth wave, as you're now beginning to see in Western Europe?
Yeah, I'm looking at the thread and the charts that you've put in there as we speak, and clearly it's of great concern. When you say that this should serve as a warning to not just Quebec, I guess what's baffling me here, Aaron, is that this is nothing new. This is how it's gone since the beginning, right? Since the very first wave, it's China, Europe, and then it comes here, and yet we don't seem to have learned any of our lessons. So
I know that's perhaps the most tragic aspect of this. I think that this springs from this tendency among humans to sometimes to bury our heads in the sand. And we've seen time and again, whether it's the state of Florida, where the death rate is also very, very high, that sometimes politicians will suppress the data or they'll be more politically motivated, and rather than being advised purely by the science. I think a country that's really acted admirably is New Zealand. New Zealand approached this in 2 ways. It had stringent public health measures, right? So the vaccine passport, which still exists there, the mask, which still exists there, plus the vaccines. This is a vaccine plus. So they're hit with BA2, and they've had a new wave. But the deaths are much, much lower. The hospitalizations are much, much lower. But in Canada and in the United States, we've just assumed we've kind of likened it to the flu. and flu pandemics sometimes last a year, last 2 years. So we're thinking that that SARS-CoV-2, the COVID, will act in the same way as the flu, but it's not. It's much deadlier than the flu.
And then you can't help but wonder, do we constantly just sort of recreate our own perfect storm whereby we relax because it's deemed that psychologically we need things to relax. We need to have, some normalcy again. And yet then we find ourselves back in the, like you said, the deja vu, back in this cycle. So at this point, would you say, Aaron, it is a foregone conclusion? This is where we're headed. We're going to have a sixth wave?
Yeah, I think I'd answer it sort of in a different way to say, I would be very surprised if we did not have a sixth wave. And then the question is, how severe will this sixth wave be? So you recall we had a fourth wave last fall that was driven by the Delta variant, and there was a lot of vaccination at the time. And so our death wave last fall was relatively in check. Okay, Things only started to creep up with Omicron. So the question is, when will we be hit with the sixth wave, and how severe will it be? So my thinking is that we're going to get a sixth wave, but it won't necessarily be as severe as the fifth wave that we had. But today we shouldn't be reporting this. 20 new deaths today in Quebec. That's not a number that we should be reporting. So what does that mean? If deaths are the most reliable indicator of the severity of the pandemic, we usually be reporting 2 deaths, 1 death, no deaths, but we're reporting 20 deaths. So that means that something is lurking beneath the surface, and it's much more serious. But we're not testing the way we used to test. So we're riding blind in the pandemic. And so this, and hospitalizations today in Quebec crept up by 5. ICU stays by 5. So we've got 1,082 hospitalizations. And they've crept up in 66 patients in the ICU. That's much better than it had been in the past. But is there something happening right now? And it's these factors. So you have waning immunity among those who've been boosted. You have a more contagious variant, and then you have this more contagious strain of coronavirus that's circulating just as we're loosening the restrictions. It's like a perfect recipe for a sixth wave.
I'm wondering, and it's just so discouraging that the decisions are made politically, right? Sort of based on popularity. I'm wondering, Aaron, do you get pushback because you're saying the things that people don't want to hear right now? Like, I feel like we're all in this state of like, no, everything's fine. We're over this. We're moving on, but we're not moving on. So do you get a lot of, sort of negative pushback?
I'm not getting really, there are trolls, but I'm not getting any pushback from the government.
Okay.
And even though, my reporting has been hard-hitting, and I've pointed out that, the government stopped making these international comparisons regarding Quebec's mortality rate, that, Quebec was not, had discontinued, analysis of wastewater to determine, the sort of concentrations of coronavirus. Since I wrote that thread, the government has announced it's going to renew that, but we haven't seen like a resumption of the widescreen testing. So that's a positive thing that I haven't received any kind of intense criticism from the Quebec government. But I've modified my threads a little bit. I'm much more careful what I write. I'm quintuple checking things, and I'm as a protocol, sort of like. I would when the premier would be giving a news conference, I would then mention him in my thread and tag him, and I've stopped doing that because that appears to have gotten on his nerves. Because then what
Thank
happens
God,
is that
I love it.
so many people are then retweeting my tweets, and he's being, he was being bombarded with this. He didn't like that. So I have stopped doing that. But people are taking my tweets, and then they are mentioning or tagging the premier.
Yeah.
So we'll see what happens, because this is an election year, right? And an election's coming in October. So when you see this play out, like politically, this could be potentially, worrisome for the CAQ government. It had seen its poll numbers drop a little bit in its handling of the fifth wave, right? But still overwhelmingly popular, still poised to be re-elected. But if we get a sixth wave, and depending on the severity, the premier might be accused of sort of not preparing and or engaging in too much wishful thinking, and then not doing enough, and
Indeed.
will that hurt him politically? And if that happens, it's mid-March. So when will the sixth wave hit? It could hit sometime in April, and for how long it might last, April,
we'll have
May,
to see.
Which takes us, into the summer, and will that hurt him politically? I don't know. I'm just mulling aloud.
It certainly should, Aaron, and we got to go because I got to get to news. But I just want to say thank you. I think I'm so grateful personally for the hard work that you do and that you hold our politicians accountable. And it's working. Thank you so very much for your time today, and just keep up the great work.
Okay, it was my pleasure, Natasha.